Stop for a moment and look at your hands, not the skin, not the joints. Look at your nails, all 10 of them. Most people glance at them and think about cosmetics, about whether they need filing, about whether the polish is chipping. I look at them and I see a 6-month archive of everything that has been happening inside your body. In 15 years of clinical practice, I have watched lung disease, liver dysfunction, and severe anemia announce themselves on fingernails long before the patient felt a single symptom, and almost every time the patient had been looking at those nails for months without knowing what they were reading. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will know exactly what to look for on your own nails tonight, what each change means, and which ones require a medical evaluation sooner rather than later. Let's begin by dismantling the most persistent myth in this entire conversation, one that has been circulating since most of us were children. White spots on nails mean you are low on calcium. You have heard this. Someone said it to you at a kitchen table decades ago, pointing at a small white dot on your finger. It is not true. Research published in the British Journal of Dermatology has definitively disproven any connection between those white spots and calcium deficiency. What you are actually seeing when you see those isolated dots are microscopic air bubbles trapped between keratin layers during nail formation. Air, not calcium. They form when the nail matrix, the tiny zone of living tissue at the base of your finger, receives a small physical shock. You pressed your cuticle back too aggressively. You caught your finger on something. You worked in the garden without gloves. The matrix took a small impact. The layers formed unevenly, and 3 to 4 months later, when that section has grown visible, you notice the dot. The original cause is long forgotten. That matters because if you have been believing the calcium myth, you have almost certainly been misreading every other signal your nails send, and some of those signals are not cosmetic, they are clinical. Now here is what makes the nail such a powerful diagnostic tool, and why it is worth understanding the structure properly. The hard plate you see forms inside the matrix. The matrix is extraordinarily sensitive to everything happening inside your body, any disruption in metabolism, any nutritional deficiency, any inflammatory process. And it shows up in what the matrix produces. The plate changes color, shape, texture, and growth rate. It records your health history the way a flight recorder captures data. A full nail replacement takes 4 to 6 months on average. That means right now, on your hands, you are carrying a 6-month archive of what your body has been through. Every ridge, every groove, every color shift is an entry in that archive. The question is whether you know how to read it. A study published in the International Journal of Dermatology examined over 2,000 patients presenting with nail changes and found that in 63% of cases, the nail finding corresponded to an underlying systemic condition that had not yet been diagnosed through routine examination. 63%, more than 6 out of 10 people showing visible nail changes had an underlying condition their standard checkup had not caught. Your nails are often ahead of your laboratory results. Let me now walk you through the specific changes that matter most, what they look like, what they mean, and when they require urgent attention. The first area is color. Because color is where the most diagnostically significant signals hide. A healthy nail is pink, smooth, and faintly translucent. The pink comes from blood flowing through the capillaries in the nail bed directly beneath the plate. Any change in the composition of that blood shows through immediately. If your nails have turned yellow, the most common explanation is a fungal infection called onychomycosis. Organisms get beneath the free edge, break down the keratin structure, and the plate thickens and discolors. Most people dismiss this as a cosmetic nuisance. That is a serious mistake. Fungal infection creates a break in the skin barrier of the foot. In a person with elevated blood sugar, what appears to be a minor fungal nail problem can cascade into bacterial infection, tissue damage, and in severe cases limb-threatening complications. This is not an exaggeration. The connection between untreated fungal nail infection and serious lower limb complications in people with impaired glucose metabolism is thoroughly documented in the clinical literature. I had a patient I will call Bernard, 71 years old, managed type 2 diabetes for 8 years. He had had discolored toenails for over a year and had not mentioned it to his physician because he assumed it was simply unsightly. When I examined him, the infection had progressed significantly and there were early signs of skin breakdown at the nail margins. We addressed it, but it required several months of treatment that could have been avoided with earlier intervention. If your nails have turned blue, gray, or violet, pay close attention. Beneath the plate, when blood oxygen saturation drops, hemoglobin darkens and that darkness shows through the translucent nail. Blue nails are a classic clinical indicator of tissue oxygen insufficiency. The causes include chronic obstructive pulmonary disease, severe bronchial asthma, congenital cardiac defects, and severe anemia. If you are taking antiarrhythmic medication and you notice bluish discoloration, do not wait for your next scheduled appointment. Contact your physician promptly. The most serious color finding I will describe is a dark longitudinal stripe, a narrow brown or black line running from the base of a single nail to its tip. In people with darker skin, this can be entirely normal, representing activation of pigment-producing cells in the matrix, but there is a form of melanoma, acrolentigenous melanoma, that develops specifically beneath the nail plate and can masquerade as a harmless streak for a long time. The warning signs that require immediate dermatological evaluation are a stripe wider than 3 mm, blurred or irregular edges, uneven coloration within the stripe, and pigment that has spread beyond the nail onto the surrounding skin. Any one of those features demands same-week evaluation, not next month, this week. The second area is shape, because specific shape changes are associated with specific systemic conditions with a precision that surprises most patients. Place your hand flat and look at your nails from the side. A healthy nail has a gentle outward arch. If instead the center of the nail is concave, dipping inward like a tiny spoon, that finding is called Koilonychia, and it almost always signals significant iron deficiency. What is remarkable is that spoon nails can appear before iron deficiency shows up on a standard blood test. The body protects hemoglobin levels for as long as possible by drawing on iron reserves, but peripheral tissues, including the nail matrix, starve first. Your nails may be ahead of your laboratory. The opposite finding is equally important: a nail that is excessively convex, domed like the glass of a watch, attached to a fingertip that is itself thickened and enlarged. This is called clubbing, and it was first described by Hippocrates more than 2,000 years ago. Clinicians still look for it today because it remains one of the most reliable physical signs of serious underlying disease. Lung cancer accounts for approximately 35% of cases in adults presenting with clubbing. The remaining cases include pulmonary fibrosis, congenital heart defects, cirrhosis, and inflammatory bowel disease. Every condition on that list is serious. You can run a quick screening test at home right now. Press the nails of the same finger on each hand together, nail to nail, bases touching. If you see a small diamond-shaped gap between the bases where they meet, that is normal. If the nails press completely flush with no gap whatsoever, that warrants a medical consultation. This is called the Schamroth sign, and it takes approximately 3 seconds to perform. The third area is surface texture and transverse grooves. Hold your hand under good light and look at the surface closely. Longitudinal ridges running from base to tip are extremely common after 60 and in most cases represent normal age-related changes in how evenly the matrix functions. But if ridges appeared suddenly over months rather than years, or if 1 or 2 ridges are dramatically deeper than the rest, that points to vitamin B deficiency, intestinal malabsorption, or early rheumatoid arthritis affecting the small joints. Horizontal grooves crossing the nail from edge to edge are called Beau's lines, and each one records a moment when the matrix temporarily stopped working: a significant fever, major surgery, a course of chemotherapy, a period of severe psychological stress. The body diverted its resources to managing the crisis and nail growth paused. When the crisis passed, growth resumed, but the groove remained. And here is what makes this remarkable. You can calculate approximately when the event occurred. The nail grows at roughly 3 to 4 mm per month. Measure the distance from the groove to the cuticle and divide by 3. The result is approximately how many months ago the disruption occurred. Multiple parallel grooves mean recurring episodes. Grooves across all 10 nails simultaneously mean the whole body took a systemic hit at once. Tiny pits on the nail surface, as though pressed repeatedly with a pin, are one of the earliest physical signs of psoriasis. They can appear years before any skin plaques develop elsewhere on the body. Your nails may be warning you about a condition that has not yet surfaced anywhere else. Before I give you the action steps, I need to say something clearly. If you notice any of the changes described in this video, do not attempt to self-diagnose or self-treat. What I am giving you today is information and the language to describe what you are observing to a physician. The clinical significance of any nail finding depends on your full medical history, your current medications, and an examination by someone who knows your case. Nail changes can have multiple explanations. Only a physician can determine which one applies to you. Do not stop medications, begin supplements, or change treatments based on what you observe in your nails alone. Now, what does the evidence support as the right approach when you notice changes in your nails? The answer is structured observation combined with prompt and informed medical communication. I want to tell you about a patient I will call Claudette. She was 68. Came to see me for a routine review, and almost as an afterthought mentioned that she had noticed a dark line on one of her thumbnails that had been there for about 4 months. She had not mentioned it at her previous appointment because she thought it was simply a bruise that had not cleared. When I examined it, the stripe had irregular edges and extended slightly onto the surrounding skin. I referred her to a dermatologist that same week. The diagnosis was early-stage acrolentiginous melanoma. Surgery was performed within 3 weeks. She is well. The nail finding was the only visible sign at the time of diagnosis. Here is exactly what to do with what you have just heard. Step 1. Tonight in good natural light, remove any nail polish and examine all 10 nails on both hands. Look at color, look at shape, look at the surface, and look at whether the nail is lifting from the bed beneath it. Step 2. Look at the base of each nail for the white crescent called the lunula. It should be clearly visible on at least your thumbs. If it has disappeared entirely from all fingers, or has become very large, that is worth discussing with your physician and requesting a thyroid panel and a complete blood count. Step 3. Press matching fingers from each hand together nail to nail and check for the Schamroth sign. If there is no gap between the nail bases, schedule a medical appointment and describe the finding specifically. Step 4. Photograph your nails once a month. Store the images on your phone. In 6 months you will have a visual timeline that is far more useful to a clinician than a verbal description of something you noticed at some point recently. Step 5. At your next physician appointment, bring your photographs and ask directly whether any of the changes you have documented warrant further investigation. Use the specific terms from this video. Ask about Koilonychia if the nails are concave. Ask about onychomycosis if there is yellowing or thickening. Ask about clubbing if the nails appear excessively domed. Specific language gets specific answers. One important clarification before we close: many of the nail changes discussed today are entirely benign in isolation. Longitudinal ridges after 60 are almost universal. Isolated white dots after minor trauma are harmless. Slight yellowing in a person who frequently wears dark nail polish is common. The clinical significance of a nail finding increases when it appears suddenly, when it is present on multiple nails simultaneously, when it is accompanied by other symptoms, or when it progresses over weeks to months. A single finding in isolation, particularly in an otherwise well person, may warrant monitoring rather than urgent evaluation. Only your physician can make that judgment with your full clinical picture in hand. Your nails have been carrying a record of your health for your entire life. Most of us look at them every single day without reading a word. That changes tonight. If this video gave you something useful, hit the like button right now. Leave a comment telling me whether you noticed anything when you looked at your nails just now, and share this with someone you care about who might be walking around with a signal on their hands that nobody has ever taught them to read. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.